Hi everyone, welcome to another edition of Menopause 101. The topic today is hormone pellet therapy. I'll tell you from the very beginning, I'm not against pellets. What I am against, as will be clear throughout this video, is that I'm against the way that hormones have been advertised and presented to women, often with incorrect information and without alternatives being presented. So let's kick things off with a little bit of history. Pellet therapy has been around since roughly the mid-1950s. It was developed in the United States by a reproductive endocrinologist at the Medical College of Georgia named Robert Greenblatt. It was popularized in Europe, probably mostly by a gynecologist in the UK named John Studd. There is research on this hormone method that goes back into the 1970s and 1980s. Hormone pellet therapy was not a very common way of giving hormones to women or men, really until about the last 10 years. I became interested in pellet therapy myself when I was a medical student, and while I was a resident, I took several days of my precious vacation and drove from Atlanta to Johnson City, Tennessee to learn how to do them. And I still have my device. This is the device that is typically used to insert pellets into an individual, man or woman, but we're going to really kind of talk about women today. So it has a trocar and it has a sharp end, and this part goes inside. This tube is hollow, so that once this is placed into the skin and in place, this part can be pulled out, and there's a little hollow tube where the pellets, which are kind of like cooked rice in shape, or actually in size, they're a little bit more cylindrical, are placed in, and then a dull end is used to push them under the skin. We would consider this a minor surgical procedure. And when we kind of talk about the good and bad aspects of pellets, one of the things to consider is whether one wants to have a minor surgical procedure a couple of times a year, and there is a certain risk of infection and bleeding and bruising and scar tissue that can form that are associated with any kind of surgical procedure. In my opinion, those are sort of minor considerations. Do I think that there's advantages to pellets? Absolutely. They do two things. They establish a very consistent level of hormone from day to day, and they're convenient. It's not a pill that you have to take. It's not a patch you have to change every 3.5 days to 1 week. It's not a cream or a gel that you have to apply to your skin on a daily basis. So that is a positive. What's my big issue? One of them is this concept that we call informed consent. Informed consent is a moral and legal obligation that a medical professional has to provide accurate information about a therapy, a therapeutic alternative, and alternative isn't another important thing. We have a duty to explain for a given condition if there are different ways to approach it from a medical perspective. In the world of menopause, that means we have lots of choices. In addition to pellets, we have patches, we have pills, we have vaginal inserts. We have a variety of different ways that we can get hormones into the body. When it comes to comparing one of these to another, that's where we start to get into some deceptive practices, in my opinion. So this is a chart from a hormone therapy practice in Denver. And what it shows here is hormone levels. It's kind of on both sides. So higher is higher hormone levels. So at the bottom here, in the low category, we have oral hormones, pills, and creams. The first question we should ask is this accurate? No, it's not accurate for oral, because oral pills create very high levels of hormone initially, at least as high as what would be seen with pellet therapy, but it only lasts for an hour. So we should see a really big spike and then more along the lines of this wavy line. Is this an accurate way to describe the way that creams or gels behave? Absolutely not. It is correct to think that in most cases the hormone level would be low, but this should be very flat. Transdermals, creams, gels, sprays, all provide a very consistent level of hormone in the body, in the bloodstream. So this is misinformation. Now let's go to patches. Do patches provide more hormone than orals and creams? It depends on the strength. So what this shows is that the levels come up and then they go down. Well, that would be true if you never changed your patch. But if you put another patch here, we would also see a nice, consistent level of hormone. Next is injections. Is this accurate? It's fairly accurate, except this doesn't show that in the very first couple of days, the hormone levels that are typically seen with injections are even higher than with pellet therapy. But it is true that you get a peak and then you get a trough or a fall back toward your normal level that has to be repeated roughly every 3 to 4 weeks until you get another injection. So now let's talk about how they have presented pellet therapy. Pellet therapy shows a rapid increase in stability over a period of time. Is this a fair depiction? Actually, it is. What's the bullshit here? The use of the term optimal. Higher is not necessarily optimal. Optimal is a term that in the world of hormone therapy rarely belongs in our language because we can't define it. Higher is not better. For an individual, lower may be much better. Who determines what's optimal? Laboratory tests? No, the woman does. And the notion that pellets are the way to get optimal hormone levels is pure fantasy. Let's take a look at an ad. I don't know who these folks are, I just found them on the internet. Allow us to help optimize your hormones with BioT bioidentical hormone pellets. Once again, we have this word optimize or optimal. It's a non-starter. That language should not be used because we don't know how to do that, and we should not conflate or cause an equivocation between high hormone levels that you do see with pellets, and we'll talk some more in detail about that in a second, and optimization. You see here a company that produces pellets. So it's an interesting thing. People that don't like big pharma, this is a national company that is the drug is being advertised, and the drug producer is being advertised in the same ad as the medical practice. Does that strike you as odd? Because it does to me. They say we have an expert team. We're BioT certified providers. What does that mean? It means they took a couple of days course to learn how to put pellets in. Does that make you an expert in hormone therapy? No. I look through the rest of this ad and I don't see any mention of any other kinds of hormone therapy being offered. So what appearance we have here is that hormone therapy equals pellet therapy. And this is what really bothers me. That's not informed consent. If you go to a practitioner, and this is where I question their expert team, because if you're really an expert team, it means that you are well versed in all types of hormonal therapy options. If the only thing that you offer to a patient is pellets and you tell them that's the way to optimize your hormone therapy, you are failing to provide good informed consent. And you're putting your economic interests, because putting pellets in can be profitable, before the patient. Now let's kind of talk about some real world data looking at what are the hormonal environments that are created with pellet therapy. So the first thing that we want to kind of think about is what is a normal, what's an average estrogen level in a woman who is, let's say, 25 years old and is cycling on a regular basis. Of course, we know that estrogen varies a lot throughout the cycle, but if we averaged out the serum estradiol level every day, what would we see? The consensus is pretty close to 80 picograms per milliliter. Don't worry about the units, just look at the number. So a couple of years ago, there was a study done randomly looking at women who had received hormone pellets, estrogen and testosterone. And they measured their estrogen level, and on average, this is not the high, this is the average, it was 193, which is 2.4 times the average level that you would see in a young woman. Testosterone also varies a little bit. It's a little more, it's a little less, less variable throughout the cycle. It's actually a lot less variable throughout the menstrual cycle. So we kind of think, for most labs would say that the normal range for an adult woman for testosterone is 10 to 55. We see that the numbers here are different than, or the units here are different than the units here. Again, you don't need to necessarily be familiar with what these units are. Just look at the number, 10 to 55. So in these pellet users, what was the average testosterone level? It was 238, which is 4.3 times the very highest limit of testosterone. Is that safe? I don't know. Does it make any sense? Does it make any damn sense to have 2.4 times the level of, in a 50-something-year-old, 2.4 times the level on average of estrogen that a woman had when they were 25, or 4 times the amount of testosterone? To me, it does not make any damn sense. I'd rather err on the side of caution and stay within physiologic limits. Does that happen very often with pellets? No, and that's a downside that you need to be aware of. You also need to be aware that pellet users have more side effects than women who use other types of hormone therapy. That doesn't mean that you should necessarily avoid pellets. It means that you should be informed that your hormone levels are going to be higher. Not that you might feel very good, especially if you're all jacked up with a lot of testosterone. I've had many patients who have had testosterone pellets say, this is what it feels like to be a 17-year-old boy. And yes, one can feel that way. But that's a pharmacologic effect. That's a drug effect, not a physiologic effect from having an average testosterone level, or we'll say a healthy for your sexuality testosterone level. The last thing to highlight about pellets, and this is something that I have seen repeatedly, and my colleagues that work in the menopause arena have seen, and it's a phenomenon called tachyphylaxis. Basically what that means is when a person is given a medication, that medication loses its effectiveness over a period of time. So the way that this often plays out is women who have had pellets, they feel great, maybe on their first or second pellet placement, and then they notice they start to not feel well for as long. So they come back to their
medical professional and they say, I'm just not feeling as good as I did before. Can I get my pellet earlier? Can you give me another, can you give me an additional pellet the next time? And what happens is that period of time that they feel good feels shorter and shorter and shorter, and the numbers of pellets and the blood levels of these hormones starts getting ratcheted up. In 1997, the first patient I saw who had that was from South Georgia, came to see me, and the story that I just told you about is exactly what happened to her. She had massive hair loss. She felt massively unwell in a lot of different ways, and yet when I checked her hormone level, it was in the 700s, which is twice what mine is, to kind of give you an example. It's in the upper range of what it would be for a male. That's a tough situation. There isn't really a good way to treat that except time. And that is something, again, that does happen with pellets. We do see it. So please be aware of that. Another aspect to consider about pellets is their irreversibility. You can't remove them. If you love pellets, that's great. If you don't, you're stuck with them for 3 to 5 months. If you've had pellets placed several times sequentially, it can take up to a year doing nothing for your hormone levels to return to their baseline level. One last thing about pellets that bothers me a lot. The companies, who will remain unnamed, who market pellet therapy, do so to clinicians that have no background in women's health, no background in endocrinology. To give you an illustration, I was at a dinner with some of my pain colleagues who are both anesthesiologists. One was having a conversation with another that I overheard. He said that a particular company, a pellet hormone therapy company, had been in his office and pitched the idea of him starting to do pellets, and he was pretty excited to do so because it was a way for him to make money. And I turned to him and I said, "What the hell are you doing? You have no background or basis in education to be doing this. The only reason that you're doing it is because it's a way for you to make money." That's another thing that you have to be aware about, is the background and education of the person who is offering you the treatment. I hope that this information you take with you, you look hard at the way that information is provided to you for you to consider different options. If you're in an office where the only thing that they talk to you about is pellet therapy, or they poo-poo and tell you that the other things don't work, you may be in the wrong place to get reliable medical information. That's all for today. I hope you enjoyed this video, and until next time, goodbye.